Hi everyone! My prompt was to describe how Gawande's article relates to the triple and quadruple aim and choosing wisely. I'm going to start by highlighting a few of Gawande's points and then specifically relating them to each of the initiatives. Right off the bat, Gawande talks about the idea of low value or no value care. Now, low value care essentially is the idea that unnecessary testing and unnecessary procedures leads to poor patient outcomes and waste. Now, to highlight this waste, Gawande gives a couple of statistics. The first, in 2010, the Institute of Medicine reported that 30% of healthcare costs were waste. The other statistic was from a study that showed that in 1 year, 25 to 42% of Medicare patients received at least one of 26 unnecessary treatments. So, how do the initiatives address waste? Well, choosing wisely addresses waste in two of its aims, which are for physicians to help patients choose care that is one, truly necessary, and two, not duplicative of other tests or procedures already received. The triple or quadruple aim addresses waste in its aim of improving costs. I translate less waste to equate to lower cost over time. Another point that Gawande makes is that doctors are in a position of power. And to illustrate this point, he uses two non-doctor examples, one of which is about car salesmen knowing more about cars than their clients, and another is a point made by 1963 economist and Nobel Prize winner Kenneth Arrow, who states that buyers have severe disadvantages when they know less than their seller does. So by highlighting these examples, Gawande's saying that physicians and healthcare providers are in a position of power over their patients. They know more, and they should be using this power to improve the health of the population. So how do the initiatives address healthcare providers' positions of power? Well, choosing wisely calls healthcare providers to use their knowledge and power to help patients get better care, and they do this through some of their interventions. One of which is for providers and organizations to compile lists of things patients should question. And another intervention is specific organizational work, one example which I'll mention later. Now, the triple and quadruple aim addresses healthcare provider positions of power as well. On the IHI website, there are 6 suggested steps for implementing the triple aim, one of which is to develop a portfolio of project work that is sufficiently strong to move system-level results. Now, this would involve using the brain power of healthcare providers and professionals to implement the triple aim and improve healthcare and the health of the population. The next point I'll highlight is how Gawande commends the Centers of Excellence approach, which is used by Walmart and several other companies. Walmart has its employees use one of 6 choice medical centers for heart, spine, and transplant services. Now, they chose these centers because they had lower rates of complications, but coincidentally, many doctors at these locations wouldn't do surgeries if they weren't necessary, and this improved healthcare costs. So, how does the Centers of Excellence approach relate to the initiatives? Well, the Centers of Excellence approach results in reduction of costs for Walmart and improvement in the health of the Walmart employee population. And these are 2 aims of the triple or quadruple aim. Now, choosing wisely through their organizational work have similar goals and outcomes as the Centers of Excellence approach that Gawande mentioned. One example I found was that 6 organizations tied to UCLA partnered to create interventions to reduce unnecessary care. Some examples were they had providers educate other providers and encouraging them to stop prescribing antibiotics for asymptomatic bacteria. They also had providers working to decrease unnecessary screening prior to cataract surgery. And these interventions help improve the population of the UCLA area health, just like the Centers of Excellence approach and the Walmart example improved the health of the Walmart employees. Finally, I wanted to mention that Gawande commended the WellMed program, which was an accountable care program for Medicare in which doctors were allowed to see less patients. They were allowed more time for their patients, and they were incentivized with bonuses to improve quality outcomes. So I wanted to point out that this program addressed all elements of the quadruple aim, including reduction in costs, improvement in quality care and patient satisfaction, improvement in health, and improved healthcare worker satisfaction. It also supports all the aims of choosing wisely, including that providers should help patients seek care that is 1, supported by evidence, 2, not duplicative of other tests or procedures already received, 3, free from harm, and 4, truly necessary. So, to continue my discussion, I wanted to talk a little bit more about WellMed and the idea of WellMed. I was really impressed by this idea, and I was struck by a story about WellMed that Gawande included about a doctor who had a patient with dangerously high blood sugar levels, but the patient wasn't actually in DKA. So instead of sending the patient to the hospital, the doctor decided to treat the patient outpatient. And the doctor was able to devote 45 minutes to the patient and then hand the patient off to the diabetes nurse educator, who spent another 45 minutes with the patient and developed this intensive follow-up plan. And I really think that's amazing. Again, anecdotally, in my hospital, we admit a lot of patients with high blood sugars that are fine and they're not in DKA, and they end up being a tremendous cost to the hospital, and providers aren't able to devote enough time to those patients, especially in light of the fact that other patients being hospitalized are in more dire situations. I had one patient that's been readmitted several times that I was the first provider to talk to him about carbohydrates, and he had been diagnosed with diabetes years ago. So again, I really like the idea of WellMed incentivizing providers to spend more time on their patients and really focus on quality measures. So to conclude my discussion, I wanted to research to see if there were any organizations like WellMed in Massachusetts, and there actually are. I'm going to include a link. So there are organizations called Accountable Care Organizations, and they're very, very similarly structured to WellMed. So they are described as paying for value rather than volume, and they're rewarded for high quality. And I'm going to quote the website that I'll share with you. The ACO, or Accountable Care Organization, quality score is based on achieving or exceeding benchmarks or showing improvement on specific measures in distinct clinical areas. The measures include process and administrative measures, clinical measures, and results from member experience surveys. And just like in the WellMed example, ACOs receive a portion of what they save Medicaid. One example of an ACO is Community Care Cooperative, which serves 123,000 Mass Health beneficiaries, and it has a focus on community. To quote their website, C3's health centers are a part of your community. They offer a range of services to individuals and families. They understand your culture, language, and life experience. So in summary, I think Gawande's article completely relates to the two initiatives that we read about, and I personally was most excited about the company WellMed, and I'm excited by the fact that Massachusetts has companies like it. And my prompt for the next student is to find an ACO or an example of organizational work from Choose Wisely that has worked and explain how it relates to our required readings. Thank you.